My name is Faisal Ahmed. I'm the Professor of Child Health at the University of Glasgow. Registries are a way of collecting standardized data sets on people with a range of conditions, common conditions or rare conditions. If two different people collect information in different ways, then you can't share that knowledge. But if you have everybody collecting the knowledge in the same way, then you can share that knowledge and develop solutions to whatever problems they've come across. A simple kind of registry would be something which is just performing a surveillance. So it sends an email to a group of people across, let's say, Scotland, and asking them if they see a case of a certain condition. And then people can report that. Then there are registries which are very much focused on a specific group of conditions. So for instance, Scotland has a small population, a relatively small population of 5 to 6 million. So from that point of view, some very, very rare diseases, we just don't have enough of those. So for that, we have to go global. And in that situation, you can have registries which are looking at specific rare conditions and collecting natural history data on that. Often people with rare conditions have a number of different conditions going on within that, so they may have a number of different health concerns. By having registries, you can actually see what the common patterns of health concerns are, and that may point you towards a certain genetic underlying condition or genetic etiology. Registries are only good if people are using the data, if people are entering data and they're using the data. So it is a circular sort of pathway, really, where people put data in, then people use the data, they find it useful, and then they will put more data in and then use it, and so on. So, and then data are used for different purposes. They may be used for care quality improvement, so improving the care of people with a certain condition, understanding the etiology, or whatever the purpose of that registry was. The way most registries have been developed, and these are, whether they are registries which are run, such as CardRisk, or other registries which are natural history disease registries and so on. The idea very much is that anybody should be able to access their data. I've always found it useful to have patients being able to access the data, because they can also act as a quality check. So they can look at the data on themselves and they can say, well, actually, yes, I'm not sure if that really is my diagnosis. And then, of course, patients act as ambassadors for registries. If they know about the registry, and the patients and the patient support groups know about the registry, and they have had good experience with them, then they're more likely to spread the word around. Depending on what kind of registry it is, there's a different level of consent which is required. So most of the data which is collected in registries where we are talking about linked data sets, so for example, the data sets I'm talking about where data are collected from different hospital activities and linked together, patient consent is not necessary for that. But use of that data requires an investigator to go through a data access committee or something like that, which is quite a rigorous way of making sure that the data are not used for anything other than its original purpose. But many natural history registries and registries which collect safety and effectiveness data and all those, for example, registries which are held in universities or by charities and things, they always go through a process of getting informed consent from the patient. Registries are very important if you want to look after people with rare conditions, especially if you want to understand how they fare over the longer term as far as their health goes. But we have to be careful when we're developing them, because the big issue is about sustaining them over the longer term. So that needs really some thought put into it.